Hello and welcome to this short video for healthcare professionals about LiveWell Dorset and how we can help you and help your patients. My name is Matt.
And my name's Emma, and LiveWell Dorset is a healthy lifestyle and behaviour change service.
So we support our clients under 4 pathways. Firstly, to help manage their weight, to quit smoking, to drink less alcohol and to get more active. And we know that many of us have more than one of these unhealthy behaviours.
This service is available to anyone living in Dorset, so if you've got any of your patients who are over 18 and residents of Dorset, then this service is available for them, and best of all, it's free.
We journey with clients over a 12-month period, so while you may see a patient maybe once, you've got an opportunity to deliver a brief intervention. If you start the conversation, we'll continue it in the long term. We'll continue to give advice, support and coaching to that patient to help them take steps to healthy living.
So this is all about helping Dorset residents to live a healthier lifestyle, and we want to partner with you to do that. And we believe that the support that we can offer alongside the work that you're already doing is going to help those people make that change.
And it works. We've supported 24,000 people to date, and we are looking forward to helping many more residents in Dorset to make a healthy lifestyle change. So how can your patient access LiveWell Dorset? Well, in a nutshell, there are 3 ways they can join us.
First of all, they can phone us on our free phone number. We have a team of locally based advisors who are ready and waiting to take their call and to offer signposting and advice for your patient.
Secondly, they can register on our website through a short 5 to 10 minute questionnaire.
And finally, there is also a Contact My Patient section which can be found on the Health Professionals page on the website.
So what happens next, Emma? What happens after a patient is registered with us?
So they will be invited to take a short health and lifestyle questionnaire, and then we will use that information to tailor advice and support to help them reach their healthy living goal.
Let's hear from Sarah, our digital advisor, who can tell us a bit more about how she advises clients on a day-to-day basis.
Hi, my name's Sarah. I'm the LiveWell Dorset digital advisor. I enjoy chatting to people who want to make that change to become healthier. It's a big step, and when they come through and chat to us through telephone or online, I'm ready to support them and encourage them and pop them on that road to a healthier lifestyle change.
Here at LiveWell Dorset, we understand how difficult it can be to make a change, and that's why we've integrated behaviour change support into our service offer. Anyone that comes into the LiveWell Dorset service will be offered the opportunity to access a wellness coach for behaviour change support.
So a typical coaching journey would consist of 6 one-to-one telephone conversations that last for approximately 15 to 20 minutes.
That's tailored completely around the needs of your patient. During those one-to-one sessions, the LiveWell Dorset coach will work with your patient to identify what barriers there might be to change. We use a model called COMBI, which looks at capability, opportunity and motivation. And then we use tried and tested interventions to help that person move forward and reach their healthy lifestyle goal.
Let's hear from our wellness coach, Matt, who can tell us a bit more about his coaching role and how he helps clients.
Hi, my name is Matt. I'm one of the wellness coaches here at LiveWell Dorset. My job is to help clients to make a healthy and positive lifestyle change. So one of the stories that springs to mind is working with a client that wanted to go smoke free. We started off by taking small steps by making her home smoke free, working on to making her car smoke free, to then giving her the confidence and motivation to join a nicotine replacement therapy group at a local pharmacy where to this date she is smoke free.
So you've heard how we can support your client through advice and coaching. There are also 3 tools on our website that can support them further.
First of all, there's the activity finder, where they can find out what's going on in their local areas.
Secondly, there's the habit hacker, which is where the behavioural change science comes into play. We'll ask the client a few short questions that can help them switch unhealthy habits for healthy ones.
And finally, there's My LiveWell, which is your patient's online healthy living profile. It's where they can go to track their progress, to access specific support, advice and tips to help them take steps towards their goal. Hopefully you're finding this video useful, but you may feel that you need some further information.
Our engagement team are our feet on the ground and can come and visit you and explain more about how we can support you and your patients. We also run public events where we can do things such as health MOTs and engage in the public and invite the public to come and think about how they can make a healthy lifestyle change.
So you may be sat there thinking about how you're actually going to tackle some of these potentially difficult conversations. LiveWell Dorset also has a training team that are available to come and run courses in your organisation, helping you to think about how you might have those healthy conversations. They're free and available to book online.
And finally, we want to supply you with resources to help have these conversations. So there are posters and flyers and business cards that you can use to hand out to your patients as you signpost them to LiveWell. So that brings us to the end of this short overview. Thank you for watching. What's next? Well, we want to invite you to really partner with us. We want to spread this message far and wide to the whole of Dorset. This is free, healthy living advice and coaching for any adult in Dorset.
We know that people are more likely to succeed at making a change if they do that with support. And the support that we can offer can run alongside any work that you're already doing with your patient. So let's partner together and see if we can make a difference. Thank you so much for taking the time to watch this video, and we really look forward to working with you in the future.